The welcome we had, you know, was tremendous. That's why his blood pressure's up.
So at Hazelwood, there's going to be 5 stations. So station 1, they'll come in here and there will be a healthcare assistant. So this is where they'll have their weights, their odds done, and then they'll come down to the corridor and go into station 2 where they'll see the physiotherapist. And then once they're done there, we've got along over here to the clinical pharmacist, where they'll get their vaccines, and then they'll see the advanced clinical practitioner here, stage 4, and then they'll come to me and they will be given a little goodie bag and their care pad and just some bits and bobs to take home, and it's just to relax after being in all of the rooms basically.
So this is our first Warwickshire North PCN Frailty Hub, which is an integrated neighbourhood team, which is a direction of travel nationally to implement the fuller stock take. This has come about because of the pressures we see every winter and how the care gets delivered to the patients. We have been doing some exercise with patients to gain their views, what matters to them. And we identified an area of a gap within the service, decided to bring all our agencies and stakeholders together and start thinking about delivering a one-stop, multidisciplinary team-run clinic for the patients. So they're not going to multiple appointments to have their assessments and try and minimize their travel, but also maximize the benefit of healthcare to them. This is also an attempt to narrow the gap of the health inequality in the area. This is quite a rural area, and it's often very difficult for patients to get to the hospital appointments or even sometimes to GP appointments as well. So we have utilized our PCN resource, ARS roles, but also have taken a lot of support from our other stakeholders, for example, George Eliot Hospital, Swift Out of Hospital teams, and this has really come together as a collaborative approach to deliver a one-stop MDT model for the patients. So our first patient has been assessed today, and we had a great feedback from him when he finished, how wonderful he felt the clinicians. There was no time pressure. He was able to speak to them, discuss things, but also left reassured that he's had a thorough assessment. And I think that's what we're trying to achieve here. So we try to gather the data, which is always challenging, especially if it is through the multiple agencies, right? Acute hospitals, out of hospital. But it was a great collaborative work along with the PCN Digital and Transformation Lead. And in the last few months, he was able to provide us the data on highest admissions, the frailty patients with chronic disease, the frail patients with higher bed stay, for example. So we wanted to baseline and assess what the magnitude of problem is. And we then identified the cohorts and we stratified them according to the risk based on their admissions, chronic disease level, etc. And we can map them through the health inequalities as well. Rural PCN is integrating with other services to deliver a one-stop shop here. But we had a huge benefit from population health management team who has worked collaboratively with PCN to give us some robust data to work from. It's work in progress, but we're hoping that we have started with the right cohort of patients at the right time just before we're going into winter.